everyone, and thanks so much for tuning in. We hear a lot of talk about health care, what are the best things to do when you're sick, what are the best insurances, what are the best practices to keep yourself well and healthy. Well, we decided to interview someone from the Memphis Common Table, and she is the project coordinator for Healthy Shelby, and she's here to talk about Healthy Shelby and also safe sleep. You're going to want to know about safe sleep because this is something that everybody who watches the show and watches any show can do something to help us improve the life expectancies of babies and to help parents not have to experience infant mortality. Everybody welcome, new to our show, Miss Debra Bartelli.
Hi there. Loretta. It's good to be here.
Good for you to be here because we have a lot to share when it comes to keeping babies healthy and also talking about Healthy Memphis Common Table because you are the project director through them for the Healthy Shelby, who also manages this initiative called Safe Sleep.
Right.
Did I get it all together?
Right. I know it's
so you come to us by way of New Jersey, and I love the city because I've heard it on TV, but I didn't want to butcher it, so I'll let you say
Hoboken.
it. Hoboken.
I moved to Memphis in '97 from Hoboken, New Jersey.
Hoboken, New Jersey. Wow. So you bring a lot to Memphis from another side of the United States that we need so much, and your experiences are so varied in healthcare, and that makes you so awesome at what you do, I'm sure.
Thank you. I've had a lot of experience in public health, and being in Memphis, I think I've had some great opportunities to work in areas like HIV and AIDS, and now with Healthy Shelby, I'm able to touch on a lot of aspects of our community's health. Should I tell you a little bit about
so tell
what
us about
doing?
Healthy Shelby and what you all are doing over there every day to keep us healthy and informed and educated and well.
Okay. Well, Healthy Shelby is a public-private multi-sector initiative. So by that I mean we're engaging both city and county governments, healthcare providers, hospitals, social service providers, members of the faith community, members of the business community, all to try to improve the way healthcare is delivered, to reduce the cost of care, which we all know is getting increasingly higher and higher, and more importantly, to improve the health of the population here in Shelby County. So those are our three main goals, and we're focused really on three areas of the health in Shelby County. And one you've mentioned, infant mortality. So we're trying to reduce our high infant mortality rate here in Shelby County. We're also trying to improve chronic disease management, both individuals' ability to manage their own illnesses, but also the way healthcare providers work with people who have chronic diseases such as hypertension, diabetes, obesity. And then finally, we're also looking at improving the way care is delivered and people's experience of care as they approach the end of life. So those are our three main areas that we're focused on.
Yeah, and I know before the show, I said you got them from beginning to the middle to the end of life, and then you said something that just summed it all up, from the cradle to the grave.
Right.
And although we don't like talking about, things that happen after life, death, of course, we don't like talking about it, but unfortunately it happens to all of us, and it's better to be prepared and to have some sense of what's going on, especially as it relates to your health care. So I don't know where we want to jump in there first, but I want to talk about safe sleep because I want us to kind of build the show around safe sleep and to come back and forth with safe sleep, because this is something, like you mentioned, we have one of the highest rates in Shelby County of infant mortality.
That's right.
And for those who are not sure about infant mortality, it is when a baby dies before their first birthday, either from SIDS or...
Well, there are multiple causes for infant death, but we're really focused. Well, let me just say that in Shelby County, we have about 14,000 births a year, and about 140 babies die before their first year in Shelby County every year. That's about what we average. And in looking at our data, we know that about 20 to 25% of those infant deaths are due to either SIDS, sudden infant death syndrome, some people may be familiar with that, or sleep-related events. And most of those deaths, those 30 deaths that we see each year to babies, most of those deaths can be prevented. So our group that's focused on infant mortality in Healthy Shelby, we decided that was something we could do something about. And so we're working together to get the information out to the public about what are safe sleep practices for babies. What can we do to reduce the chance that a baby will die in its first year? And some of it is really simple to remember. We're calling it the ABCs of safe sleep. So what are those ABCs? A baby should sleep alone, on their backs, and in a crib. So.
Okay, I want us to take those separately. I wanted to make sure everybody knew what the ABCs of safe sleep are, and A stands for alone. Please, I know we love our babies, we love our grandchildren, and we want them to sleep with us because we want them close all the time. But that is huge when it comes to infant mortality, because unfortunately they're what they call rollover deaths. You could actually roll over on the baby and smother the baby.
Right.
So, and other things that can happen too when the baby sleeps with other people. They can get caught in the mattress, they can get caught between the wall and the mattress, and they can wake up and climb and get, you know, some people have these headboards where they have these little slants in them. So, and these are deaths that we know have happened from these things. So we're not just saying it to scare anybody, we're just trying to say it so that you are aware that that can happen. And we know, based on research and documenting every birth that ends up with infant mortality, that these 30, this is what has happened to these babies.
Right.
And so the B is for
sleeping on their backs.
Sleep on their backs. And that's huge because, you know, when I was raising kids and when I was being raised, it was put them on their stomach. And so there are a lot of old school parents and grandparents who still want to put them on their stomachs.
Right.
So I wanted to bring you here because you guys are the experts. You have the documents, you have the research that says if they sleep on their stomachs, a lot of babies have ended up, you know, dying from SIDS and then from a lot of things that can happen. You know, I don't want to be too graphic, but please put them on their backs. The B is for on their backs. A is for let the baby sleep alone. B is for make them, because it's hard, because they want to roll over to their stomach. Allow them to live longer by letting them sleep on their back. And the C is for?
In a crib.
In a crib.
And a crib can be a bassinet, it can be a pack and play. You know, it doesn't have to be a crib, but it is a bed that is set aside for that baby, and only the baby sleeps.
Only the baby. No cute pillows, no stuffed animals, no toys, no little things.
No blankets.
You know, no blankets, just the baby. You know, and I said, well, we want to keep them warm, but be careful. You know, we're talking about stackable blankets that are used for decor. Now we know we need to keep them warm.
But really no blankets on babies. If you're warm, the baby is warm. And so there are plenty of outfits that babies can wear, you know, the sleepers that they can sleep in, and that's really what you need to put the baby in. Sometimes babies can overheat, or they can suffocate from the blanket coming over their heads, over their faces. So no blankets, just the baby in the bed.
Because I know as adults, we tend to have covers because that's what we're used to, not because we're cold or we're hot, because I know my little grandson, I'm cold, but he's sweating sometimes, so they have a tendency, their bodies heat up better or faster than ours or something I'm learning, and he doesn't need that extra cover, because he will start, you know, not like sweating profusely, but he'll get a little damp around his little hairline, and I can see he's too hot, so he really does not need a blanket. He does not want a blanket, but his jammies with the little feet in them are enough.
That's right.
So make sure, and I know this is new and for some people, and then it's old news, but we really, if we're going to save the lives of babies and to make sure families don't have to go through and experience infant mortality, we have to follow these simple little things, the ABCs of safe sleep. And we will go over those again, everybody. There will not be a test, but we're going to make sure that we continue to say the ABCs of safe sleep: alone, on their back, in a crib. So
you've got it.
Well, I was at the kickoff, and you guys did an amazing job with that press release and press conference, telling everybody what to do. So, and then there's social media, because we all use social media. Everybody, cell phones are just an equal opportunity for everybody, from no income to, you know, millions and billions of dollars. You got cell phones. So everybody pretty much uses social media on their cell phone. So you guys are brilliant. You know to use social media to get to people easy, fast, and often. So they can sign up to Facebook. Everybody's on Facebook or know somebody who is.
And search for Baby to Sleep.
And that's the
on
number.
Facebook. Baby, and the number 2, sleep.
Mm-hmm.
Just do a search on Facebook, and you should find our Facebook page.
Mm-hmm.
And that'll have information on it about the safe sleep practices. We have a video. And as time goes on, we'll have more and more information on that Facebook page.
Okay.
But we have a couple of other things too that I'm really excited about, and one is our text messaging campaign. So I'd love all your viewers, especially those that have a young baby in the house,
or expecting a young baby, or the godparent of a young baby, the aunt, the uncle, the auntie. Everybody needs to know this. Get this text thing done.
So you text Safe Sleep to 90105, 90105.
It's our area code in Memphis, which is 901, and then 05.
Right.
Yeah. So you can remember that. Text 90105
with the words
Safe Sleep. And then in return,
every day you'll get a text message that will have reminders like, it's nap time, is your baby on its back? Or did you get a flu shot? Or remember, don't let anyone smoke around your baby. So every day there'll be a different message. And then we'll also be having text messages to let you know about events, free events in the community that you might be interested in attending.
And probably resources too, because sometimes there's somebody that we find out there's giving away cribs or car seats, or because people have those questions, where can I get a crib? If you want me to have a crib, I can't afford a crib. I know there are resources out there that will provide free cribs.
Right. So we'll have those text messages that will get pushed out every day. So all you have to do is text Safe Sleep to 90105.
Okay, and I know somebody's doing it now, right? You're doing it right now. You're texting 90105, Safe Sleep, signing up, and then you'll get a text message every day with a cute little reminder to say, hey, make sure the baby's on the back. Make sure nobody's smoking around, because we know the moms, even moms, don't smoke around your baby. We're not saying don't smoke because you're grown. Go outside and smoke, go in another room and smoke. But, to help save your baby's life and any potential health concerns, don't allow people to smoke around them.
That's right. Yeah, that's really important.
Yeah.
It's one of the best things you can do for your baby.
I think so. And, because I'm a non-smoker and I can smell smoke a mile away. I can tell, who's been around my grandson with smoke on, because I can smell it on his little coat or something. But we got to do this, because this is preventable. Some of these deaths, at least 30 of them we know, are preventable, preventable.
That's right.
And so they can also Twitter.
Right.
Yeah.
Now, I don't tweet, but I know a lot of people do. So we have a Twitter account, and we'll begin pushing some tweets out to folks. So if you want to follow us, we'd love for you to do that.
And that's at Baby, the number 2, Sleep TN. Baby 2 Sleep Tennessee.
Right.
And that's the Twitter. And you'll get tweets.
Right.
And you can tweet back.
Right. One of the things I'm really excited about is our free mobile app.
Yes.
So I wanted to talk about that too. And that you can download if you have an iPhone or an Android. And I've been told you can download it on iPads as well. But that app is Baby 2 Sleep. Baby, the number 2, and Sleep. So download
a free app that you can get on your phone to get all this same information that we talked about on the Facebook page and in a text message and on Twitter. You can get it on your smartphones, on your iPhones, and on your iPads.
Right.
Wow.
And the great thing about the app too is it does have resources. It'll have lots of links to community organizations, to different resources in the community that can help new parents or families, but also there's a community calendar that will let you know about events, free events like baby showers and different opportunities like that, that new parents or that people who are caring for babies might be interested in.
See, that's why I love it, and that's why I'm going to download it. I was intending to do it when I first heard about it, but I'm so going to do the download, the free app on my iPhone, and so I can get information. I don't currently have a little tiny baby, but I told you I have my grandson, and I have a goddaughter that's, like 5 months old, so I'm around babies because I love babies, and I want to do my part to keep them safe and healthy so that they can live long, healthy lives, and the parents won't have to go through experiencing infant mortality. So, Deborah, we're going to take a break, and we're going to come back more and talk about Healthy Memphis Common Table, and I probably butchered that, and Safe Sleep. We'll be right back in just a moment.
Great, thanks.
life's this hard, it can be harder. But even the students in your community make it through by visiting boostup.org. When life's this hard, graduating can be even harder. But you can help David and the students in your community make it through by visiting boostup.org.
G-morning, sunshine. Wakey, wakey. Text me. Are your parents home later? We can hang. LUV, love you. JK. Holla back. Holla back. Holla back. Are you with your friends? That's lame. We're in a huge fight right now. XO. Would you dream of something I did? Are you on your way to the lonely nude pics? Send me some. Text me.